Viewing or listening to this podcast confirms acceptance of the disclaimer visible on your screen or found at authorscott.com/podcast. Welcome to the Regaining Health and Humanity podcast. I'm Dr. Scott Johnson, your guide on this journey to natural well-being. Here we explore evidence-based insights, revolutionary breakthroughs, and powerful health strategies that not only inform, but inspire change. Together, we'll uncover the mysteries of human existence and unlock the secrets to thriving. This podcast is more than just knowledge. It's your catalyst for unleashing extraordinary potential. Get ready. Your journey to boundless health and happiness starts now. Hello, friends, and welcome to the Regaining Health and Humanity podcast. I'm your host, Dr. Scott Johnson, and today I'm thrilled to investigate powerful connection between the lymphatic system and the vagus nerve, two essential components of your body that are often treated separately, but actually work in harmony. To explore this topic, I've invited Dr. Arianne Missimer. Dr. Missimer is a functional medicine practitioner, doctor of physical therapy, registered dietitian, mindfulness instructor, and owner of the Movement Paradigm Integrative Health Center in the Philadelphia area. She is also a columnist for Strong Fitness magazine and a medical educator for Rupa Health, specializing in whole body wellness through integrative and root cause medicine. She is one of only 2,500 practitioners globally certified through the Institute of Functional Medicine. Additionally, she is an international and TEDx speaker and an award-winning recognized health and wellness leader featured on ABC, CBS, Fox, and NBC. Personally, Dr. Missimer's journey into the health and wellness field began after her brother passed away from cancer. She was driven by the purpose he instilled in her to change lives and help people never take their health and life for granted. However, her journey took a significant turn when she herself was diagnosed with stage 3 liposarcoma. This experience led Dr. Missimer to explore the impact of trauma and nervous system regulation. Her experience with functional medicine post-cancer treatment made her realize the importance of a holistic approach to patient care that truly meets patients where they are and considers all aspects of their health. Dr. Missimer also wrote a book called Rise Up, which inspires and empowers people to heal. So welcome to the show, Dr. Missimer.
Thank you so much, Dr. Johnson, for having me.
Well, I'm excited about the topic because I think the vagus nerve is trending right now. And a lot of people will ask me, well, what can I do? People talk about doing this to it. And so what can I do naturally? So I'm excited to explore this topic, particularly in its connection to the lymphatic system. Can you explain how the lymphatic system and vagus nerve work together and why they are often overlooked as a dynamic duo in healing?
Yeah, so I think that the lymphatic system and the vagus nerve, as you said, it is trending, but typically are overlooked overall as a root cause of true healing. And I feel like the lymphatic system in particular is one of the most neglected systems in the body. And then when we can start to look at both of them together, how I view it is they can help bring homeostasis to our body. And so let's kind of just separate them for a moment. So let's talk about the lymphatic system and just thinking of that as our waste removal system. So it's ultimately taking that fluid from the interstitial space, and it's taking any waste or metabolic, waste that needs to be removed and filtered, bringing it back into the bloodstream. But our nerves and our bones and our muscles and our organs and everything is bathing in the lymphatic system. So if we take it to the vagus nerve, if we think that's 80% of our parasympathetic nervous system, which is ultimately going to be responsible for how we rest and digest, and also how we regulate inflammation, we have something called that anticholinergic effect, which is going to be an anti-inflammatory effect from the vagus nerve. So we can start to bring these two things together, recognizing that we're bathing in, the vagus nerve, for example, among everything else, is bathing in the lymphatic system. And it's also having a profound impact on the immune system. When we can bring these together, we can start to see really powerful changes. So I get really excited about them because I love them both so much.
I think you're right that so many people overlook them as part of a treatment plan or treatment protocol. And it is something that we probably need to bring more awareness to. That vagus nerve is a major highway of communication. And so it's important that obviously is functioning properly. Imagine being stuck in a traffic jam, and nobody likes that. You're not getting where you want to be, where you need to be. Same thing with communication. And if that vagus nerve is jammed up and it's not functioning properly, we're going to have the same scenario where things are not getting where they need to be.
Right. And just to add just one more thing to that too, is that with the vagus nerve innervation, so just for the listeners, as it exits the brainstem, we have branches into the ear, into the throat, into the heart, into the whole digestive tract. And so with the innervation to those smooth muscles in the viscera, that is actually what's helping to create a pumping mechanism for the lymphatic system. So that's also yet another area that is so important. And in the gut, there's all of the innervation of the vagus nerve, but it's also 70% of our immune system. So as you said, when we start to have that superhighway that's affected between the gut and the brain, that's going to have a potential huge effect on the gut, and then the gut's influence on the immune system and lymphatic system and so on.
That's a perfect segue, I think, into my next question, because there is a strong correlation between our gut health and stress and also even mood. So how can chronic stress stagnate both of these systems, and what are the long-term consequences when this happens?
That can happen in different ways. One in particular, as we were just talking about, is that with chronic stress, we're going to change the colonization of the bacteria in the gut. So we actually decrease the beneficial bacteria of the gut, and we can increase the opportunistic bacteria, creating a whole world of dysbiosis, but often creating this inflammation that is signaling back to the brain. So that can create a lot of havoc from the nervous system aspect, but then also we have all of these lymph nodes. There's so many in the liver and the small intestine, actually our greatest amount that are coming from there. So that when we start to have more and more inflammation there is going to create more downstream effects. So then we have this chronic cortisol release. So if we're thinking of our HPA axis, and we have this chronic cortisol release that initially is just kind of starting with a baseline, an acute stressor from baselines. We have all of the normal responses to that, but then we start to have chronic stress, as you mentioned. And so with chronic stress, I think we're in that chronic sympathetic state. We have blood flow that's moving away from the digestive tract. We decrease mobility. We decrease our immune responses. We decrease digestion, and so on and so forth. So then we again start to have more downstream effects of this chronic stress as it relates to, I refer to as chronic stagnation in both systems.
Right. It's we kind of live in a stress-laden society where we're just constantly stressed because of the way that we live in society, and the way that we've adapted to modern society has just left us in this chronic state of stress that really needs to be addressed in order for us to have optimal well-being. One of the things that I think people often overlook is sleep, because in modern society, again, we're thinking, oh, well, if I only sleep 4 or 5 hours, then I'll have 3 or 4 more hours in my day that I can get things accomplished. I'll be more productive, more effective. But the reality is there's so many important things that occur during sleep, one of which is brain detoxification. And so I wanted to ask you, what role does the lymphatic system play in brain detoxification during sleep, and how does the vagus nerve influence this process?
I'm a huge fan of sleep too.
Yeah.
I talk about it so much. And I just want to just add to that a little bit, is that you're right. It's not just as simple as even just sleep hygiene and people just not allotting for enough time, but there's also so many airway issues, and there's upper airway resistance, there's mouth breathing, there's obstructive sleep apnea, and things that are overlooked for years and years and years, and they're never detoxifying. They're never in a parasympathetic state. They're always in this chronic stress state. So There are so many root causes that I think are really important. And as it relates to the lymphatic system, just kind of think of it as our lymphatic system for our brain, where we have cerebral spinal fluid that's really getting into all of the little nooks and crannies of the brain, allowing us to filter, to bring nutrients to that area and truly detoxify. So if we are not regulated in our nervous system, i.e., being able to shift towards that parasympathetic state, then we're not going to be able to sleep well. So that's where we start to see people waking up at 2, 3, 4 o'clock in the morning with these early cortisol spikes. They're not getting proper melatonin production. And so if they're really dysregulated for whatever the reason, maybe that is a physiological reason, they're not getting enough protein during the day, or their blood sugar is dysregulated, or they have chronic stress, or all of those things, then unfortunately they won't be able to sleep well for that natural process to occur as it relates to the lymphatic system. And also preventing neurodegenerative diseases, like getting rid of beta amyloid, which is the plaque that contributes to things like Alzheimer's disease.
So I think it's definitely an important thing. We need to have, I call it almost like a dishwasher effect that's going on while we sleep. Your neurons open up, the space between them a little bit opens up a little bit more as you sleep. And then this fluid runs through there and pulls things out. And like you said, brings nutrients to the cells. And so it's such an important process that we definitely don't want to shortchange by not having better sleep. One of the things people may ask that are listening to this is, how can I know if this is happening to me? I don't have good vagal tone. My lymphatic system is stagnated. So what are some of the most common signs of lymphatic stagnation and poor vagal tone? And how can someone recognize when both systems are being affected?
That's a great question. And interestingly enough, there are so many symptoms, but I'm going to just highlight some of the more obvious things. So from a lymphatic system, because I think everyone, all the listeners can appreciate this, is we get sick and we might feel a swollen lymph node. That would be, kind of a very obvious response of our lymph system doing exactly what it's supposed to do. It's responding to some type of foreign invader. However, it's not always that obvious. So we might have things like puffiness in our face. So we wake up in the morning. A lot of my patients that don't sleep well, they wake up and they're really puffy around the eyes. They might have swollen ankles. They might have swollen hands. So it could be very obvious symptoms of inflammation. Also things like a injury that's not responding the right way, or well past our normal healing phase, depending on the injury, and you're still getting some swelling and pain and things like that. So those would be kind of the more obvious lymphatic issues, but then I'm going to segue to that and then bring them together. So nervous system wise, this is where there's so many things. We can think of our obvious digestive issues. So bloating, IBS, chronic IBS, constipation, diarrhea. We can have dysautonomia. So that could be everything from, just think of dysregulated nervous systems. That could be our blood pressure dysregulation, low heart rate, tachycardia, high heart rate, headaches, migraines. But really every system could have symptoms. It could be respiratory, it could be cardiac, it could be endocrine. And that's what, quite frankly, makes it really challenging to know, do I have one of these issues? And one of the things that I always say, because most of my patients, I'd say almost all of them, come in with very, very complex issues with so many different symptoms, lists and lists of symptoms in every category, every system of the body. And when I zoom out, even though I'm going to address all of them, I still zoom out and just say, what is the core issue here? There's systemic inflammation and there's a nervous system issue. And so that is, hopefully that take home. If you're listening to this and feeling like, oh my gosh, I have so many things going on and I just don't even know where to start, probably these two are a really good starting point.
That's what I was going to ask you, is if people come in with multiple symptoms, and that's a lot to unpack with a single person, you just take them down the path of, let's do some supportive therapy for both the lymph system and the vagus.
And I would say, just practically speaking, I might be giving perhaps supplementation, nutrition recommendations, movement recommendations, all of those things. But then I'm going to be really specific about nervous system. So for one person, I might say, actually today, I said she used to love Qigong. That was her favorite thing. And I said, but she's not doing it now. And she has complex trauma and, a lot of different symptoms. And so I just said, I would love for you to do 5 minutes a day of Qigong. So that was my prescription, if you will, for nervous system regulation for her. But then someone else, I might give them 3 vagus nerve exercises. And someone else, I might say, I want you to walk for 5 minutes, 3 times a day. So it just depends on where they are, but I try to make it very tangible so that they know, first of all, consciously, I'm working on my nervous system, because I think that makes you more mindful. It helps you to build that internal awareness of self. And then we'll, of course, get into the lymphatic piece too, but a lot of these things can overlap really well.
You just mentioned some of the practices or some of the tips that you're giving your patients to help them with these 2 issues. Are there additional daily practices that you would recommend for improving lymphatic flow as well as vagal tone simultaneously? Can you work on both of them at the same time?
Absolutely. And I'd say the best way is diaphragmatic breathing, because we, again, need to rely on the skeletal muscle pumps for the lymphatic system. So breathing is going to stimulate the vagus nerve, because the vagus nerve is going right through the diaphragm. So it's directly stimulating it. It's creating that relaxation response. It's releasing neurotransmitter called acetylcholine. So creating that. And the longer the exhale, the better. But then in addition to that, that could be the respiratory pump for the lymphatic system, which is really cool, because we have so much lymph in this whole abdominal and thoracic cavity. So we are getting a great lymphatic boost by doing that as well.
Great.
And the diaphragm massages all the organs. So that creates that stimulation of all the smooth muscle.
And so simple to do that too. It's not something that you would have to invest in expensive equipment to do or anything. It's just a matter of being aware and taking the time to do that on a regular basis to kind of press that reset button for the system, right?
Yes.
How about how does self-lymphatic massage and vibration techniques like humming or gargling enhance these systems?
I'm a huge fan of those. I typically prescribe them once I've established some basic detoxification practices. And this would be in the beginning for most people, but I might guide them on how often they would do it and how to ease in, make sure they're supported so that if they do have a detox reaction, they know what it is, they know how to manage it, they're drinking enough water. And with that, I typically will do a basic technique using the different mechanoreceptors. So it would be starting at the left collarbone and the subclavian area. So it'd be feather light, faster, deeper, tap 1, 2, 3, 4, 5, and then pull in the direction of the heart. And then slowly go through, and I'm happy to send you a link to a quick lymphatic drainage. Go through each of the main points where there's a lot of lymph nodes, just kind of the bigger gatherings of those. So that could be the basic practice that takes literally 60 to 90 seconds. It's super quick. And then progressing into dry brushing and doing that on alternate days. So that can be a great way to exfoliate. It's a great sensory stimulation, so amazing for the nervous system and regulating that, and also getting the benefit of the lymphatics drainage. So it's a really nice combination of those.
It's interesting that you talk about nervous system stimulation, because most of us have probably experienced where somebody's doing light touches on our back and scratching it. And that's a nervous system stimulation that's going on right there. It generally feels good for most people. And it's something that also has some downstream effects on the nervous system. I actually introduce a technique that I have developed called the waterfall technique that uses a similar feathering technique down the spine to stimulate nervous system activity. And so it is something that I don't think we're very mindful of, that we can do the same thing to ourselves. You don't even have to go to a massage therapist or say, hey, well, you scratch my back. We can do that to ourselves. And so it's just remembering to do that self-care and to do these techniques.
Yeah. And then just to answer, I didn't quite answer about the humming too.
Yes.
So the humming is a really great way to stimulate the pharyngeal branch of the vagus nerve that goes into the throat that affects our swallowing or vocalization. And so the vibration of the humming can help to tone the vagus nerve. And that's really the word that we want to use when we're talking about the vagus nerve. So I like to use the analogy of, let's say we're strengthening a muscle. per se strengthening it, but we're improving the tone of this nerve. And so that's where this use of the repetition of things is going to be so important to do. So the vibration can help to stimulate that, but it also can help with lymphatics as well. So again, a little bit of a boost for both, which is really nice. I use humming quite frequently. I actually use Lois Laney's work and do very specific neural reprogramming techniques of the cranial nerves. And humming, there's a version of her humming that is really beautiful, but that can be very helpful for reprogramming people that have a hyperactive gag reflex or just other swallowing issues, things like that.
Physical activity is super important as well, particularly when it comes to the lymphatic system. People don't realize that the lymphatic system is a series of vessels throughout your body that are pumping fluid, but the problem is it doesn't have a heart that acts as that pump. And so most of the time, in order to move that lymph, you have to have physical activity or you have to massage the area. Those are the two primary ways to move lymph. Why is physical movement, such as walking or rebounding, so critical for lymphatic flow?
That's where kind of coming back to just reiterating this too is so breathing would be one way and then movement is going to be our other way. So that's where we want to be able to use those skeletal muscle pumps, especially the calf specifically. That's one of our biggest skeletal muscle pumps and the respiratory as well. So the rebounding, the bouncing nature of that can be really helpful. Walking is so easy and so basic. You don't need a trampoline. You could just go outside and walk. That is another, I would say, kind of double whammy. So it's helping nervous system and it is helping the lymphatics. But so often, as we both know, most people are not walking that often. They're, sitting at their desk most of the day. And it's really, when I tell people, I'd really like us to work towards 10,000 steps a day. Your eyes initially, kind of bulge. And I say, it's okay, we'll get there. But I just want you to know that that's for health reasons. That's very reasonable to ask. And so it's just interesting because when we start to really track, some people are getting 2,000, 3,000 steps a day. And so, of course, their lymphatic system is going to be stagnant, right? And that's where they might have those more obvious symptoms of swelling and things like that. But they also might have a dysregulated nervous system because they're sitting all day and they're not utilizing their fascial tissue and they're not using that sensory feedback from the environment.
When somebody wants to incorporate either rebound or walking into their life for these reasons, is there a specific amount of time they have to walk in order to start seeing these benefits? And do you have a specific amount of time of jumping on trampoline in order to get these benefits?
So it just depends on where someone's starting. So for example, if they were doing the lymph drainage, I always have them bounce or shake for about 30 seconds to upwards of 60 seconds after they do the lymphatic drainage. So if they're doing rebounding, if they've never jumped before, then I might have them start with 1 minute, right? And then potentially move up to something that they feel comfortable with. And a lot of times they love it and they have fun with it and it feels good energetically, emotionally, physically. So then, I'm happy to help people increase that time if it's really a net positive in a lot of areas. And the same thing with walking. It really just depends on where they are. I would rather someone who's not walking walk more frequently throughout the day in shorter bursts than go for 1 hour walk.
Right.
That is always my preference. I know that I think that might be opposite of what people think. They think like, oh, I should just go for an hour walk. But I always suggest I'd much rather you get up 10 times a day for a minute than go for a 10-minute walk, So even that, I'd love for them to just move more frequently throughout the day. So it really depends on where they are on their journey. And as it just relates to lymphatics, doesn't have to be much. It just has to be intentional. As it relates to all the other benefits, that's when I would say I'd love to help guide them into a more of a lifestyle practice.
That makes total sense because once that movement stops, then we could stagnate again with that lymphatic flow. So it makes sense that you want to get up frequently and move more frequently throughout the day rather than just have, oh, I did it in the morning, now I'm all done. I don't have to move the rest of the day. Now I can just lay back in my easy chair and watch Netflix.
Exactly.
Are there specific exercises that double as lymphatic boosters and vagus nerve activators?
Yes. One of my favorites is called a neck release. So you essentially take a flat hand. You could do this on both sides. So you take a flat hand and you just come right underneath of the ear here. and you traction the tissue. This is where the vagus nerve is coming down, and it's coming kind of right in this space here. So we're tractioning the tissue up. And this is also where, when they did ultrasounds of people that had COVID, this is where the vagus nerve was thickened, was inflamed. So this is a really, really, really great area. You hold the tissue until you have a sign of relaxation. So it could be a sigh, a swallow, a yawn, but it also could just be that you feel a sense of some swallowing. It could be a sense of relaxation. It could feel like a sense of warmth, because this is also where we have so much lymph tissue. So this is a crowd favorite for sure. And you could do it very subtly. You could be at work and just leaning into it. No one would even know you're doing it. So a lot of my patients really love this one. And then another one that I really like is a thoracic inlet release that, again, we have so much lymph in primarily, I didn't really talk about this, but the left side of the head, and then most of the body is draining on this left side, this subclavian area, and then just the right side of the head and the right arm are draining here. So when we're emphasizing this whole area, we can really get a lot of vagus nerve and lymphatic boost. So the thoracic inlet release is you basically come underneath of the collarbone here, and ideally kind of rest your arm. So when you're pressing up into it, essentially what you're doing is allowing the collarbone to just float. That's what it should feel like. You're resting your collarbone on your thumb. When you're hanging out there for a little bit, then you can start to traction that out towards the collarbone. And this, again, you'll just start to feel a lot going on here. A lot of, because there's vascular changes, there's lymphatic changes, there's the nerve changes. There's just a lot happening. So this is a really powerful one. And then, of course, like we talked about, is like the breathing and just walking or bouncing. So really kind of I have a lot more that overlap, but those are, I'd say, really specifics that are very effective for both. And then, of course, incorporating the breathing into all of them.
Great. Can you explain the Lymph-Vagus reset routine and how it is beneficial to improve lymph flow and vagal tone if you perform it each morning?
Yep. So this would actually include those two things. But the first one we would start with, a little acronym, and it can correlate with your day, or it could just be how you remember it, but it's birth. So think of like birth of the new day. So the first one would be bouncing. So that one, when you wake up, just kind of getting into a bounce that feels comfortable to you. You don't have to leave the ground. You don't have to jump. You can just kind of bounce, loosely shake. Everybody looks different when they do it, and just make it your own and have fun for at least 30 seconds, but you can, of course, do it a little longer. Then it would be inhale, exhale. So inhale normally, that creates that initial sympathetic response. Then when you exhale, you want to try to do an extended exhalation. So just ever so slightly longer to create more of that parasympathetic response, and also, again, create that lymphatic pump. Then we would do the neck release that I just mentioned, and then the thoracic release that I just mentioned. And then the last one would be humming.
Do you have any materials or a website that we could push people to that teach them this? Because some people are visual learners and maybe they're only listening to this and they don't have the video that they're watching, so they want to learn it. And how could they do that through you?
Of course, you can go to our YouTube channel, The Movement Paradigm, and there's hundreds of videos on vagus nerve exercises, somatic practices as well, lymphatic. So you can really get a wide array. And you can always go to our website too. And we have all of our blogs there with all the detailed information about that. And that's themovementparadigm.com.
Great. And I think that'll be beneficial to a lot of people who are just listening to the podcast to go there and get some more instruction from a visual perspective and be able to learn these techniques that are simple. So it's something that we can, again, include in our self-care on a daily basis, and these really important systems in our body that are going to help us to reach that optimal health that all of us want to. So I appreciate you being on, Dr. Missimer, and for the tidbits that you've shared with us. I hope people have learned more about their vagus nerve and how important it is, as well as the importance of the lymphatic system, and that this will spur them on to be able to put more attention to these two systems.
Thank you so much for having me, Dr. Johnson. I appreciate it.
Thank you for sharing your time with us today. I hope you've gained insights to elevate your health and life. For more transformative evidence-based wisdom, I invite you to explore my 20-plus books at authorscott.com/shop. Don't miss out on the chance to supercharge your health and guide others to a better life. Like, share, and subscribe to join the movement transforming lives. Here's to your journey toward boundless health and happiness.